one of the most common reasons people contact me individually is about getting support or suggestions or even understanding when they themselves or their loved one or their children seem to have some mental health issues. So I in fact I dealt with this just today and an hour ago, and so I really was happy to do this presentation and put my thoughts together. I'm not a clinical psychologist. Although I have lots of background in psychology and training in clinical methods, I work in the field of human services, and particularly sort of in the whole systems area in the federal government. So I work sort of at the systems level, but in my ministry and church work, I've done lots of counseling and psychoeducational programming. So I'm coming to this more trying to give us a broad context to open dialogue in our community, and to provide some practical understanding, ways we can understand this, and maybe move forward, things that we can do on the ground, like for leaders. Okay, so that's my goal here today. I don't really want to talk, I'm not going to be talking extensively, specifically about specific mental health like depression or anxiety, but in my own life, I have certainly taken, solved my own anxiety issues by, accessing mental health services and energy therapy, and I do yoga, and I truly believe in taking a broad approach to my personal, self and health and recreation. Okay, so let's get going here. This has been a, this presentation will cover kind of an introduction to the big picture, like there's tensions historically between religion and psychology, and we'll go through, why this issue has been very difficult to talk about in our community, especially in the West, and what are our common roadblocks that I experience when people call me to seeking treatment, and what kind of perspective can we have, I'm going to open up that dialogue because I think that there's lots of people that may have lots of things going on in their mind, and it's a big conversation. How what is a big wide angle perspective on the role of mental health and spiritual practice in these type of matters, and how can we give advice and support effectively to our friends, our neighbors, as blessing and family ministry leaders. And since there are a plethora of therapies and healing modalities, how do we choose well, and how important it is to have support for family members, and then we'll talk about developing community resources. And so please make sure you submit your questions. Okay. So I thought I'd put this in to make a point that religious inspiration and mental instability, that there are sometimes, actually we should admit this, that there's a soft boundary. And so so Abraham, claims, and he's certainly one of the foundations of our faith tradition, that he heard a voice tell him to kill his son, and Andrea Yates did too. So without disrespecting religion, because I deeply respect it, that the religious imagination can lead us into ecstatic union with God and with each other, and it can also be corrupted. Okay, so easily corrupted, and we certainly have a worldview that gives us some ways to understand that. Okay, and then I thought about Robin Williams, and I thought this was a really interesting quote because certainly this man had access to the finest resources, and he was not unaware, and he makes a good point. Depression is very real, and it is perhaps the most common thing people go to therapists for is anxiety, and anxiety and depression are like two sides of the same coin, and there's quite a spectrum on how these symptoms may manifest. But of course, if you know someone who's committed suicide or you've contemplated suicide, then you know how heartbreaking it is to families and friends, and our own teachings, which tell us how precious life is on earth. So mental illness is a very real illness, or real unbalance in the human system, and we have to take it more seriously and provide a context for understanding. Also, did you know that many providential figures suffered from extreme difficulty? Winston Churchill, I forgot the author, I should quote it for you, but he named them, I guess he referred to his black dog days. So he exhibited symptoms of what we would call bipolar disorder today. Beethoven, Calvin Coolidge, Princess Diana and her bulimia. Many creative people, as a matter of fact, have suffered bouts of melancholia. And maybe a famous one is Abraham Lincoln. He suffered from recurring depressions and suicidal thoughts. So just because you are a providential figure or a religious person or a creative person, you're not necessarily protected per se. As a matter of fact, you might be more likely in some circumstances, if you're a public figure, to suffer from mental or emotional, spiritual instability. So where did this tension, at least, I mean, we have to sort of limit these comments because these could be things we talk about forever. But where does it begin that Western psychology and religion have had a tense relationship? Well, okay, let's go back to Sigmund Freud's view in The Future of an Illusion. Just the title of the book should tell you that Freud himself in this whole era, he thought that, of course he's in the Victorian era, right? He's kind of emerging out of that, and religion and science are moral enemies. And in his writings, you can see that Freud viewed religious devotion as kind of like an infantile or a lower form of human life, human psychological growth. You could say at best it's obsessive neurosis. It could be, you know, narcissistic delusion. Hold on. Sorry about this. Okay. And especially he saw strong religious devotion as a source of negative repression. Now, other people in the Freudian tradition, particularly Jung and Fromm and Erikson and many others who, you know, came after Freud, had a much more broad view of religion, and such as William James in The Variety of Religious Experience. James took a much more balanced view. He said there's religion of the sick soul and religion of the healthy-minded soul. So he saw that our imbalances or negative mind, positive mind, however you want to conceive it, plays out through the way we practice our religion, through the way we understand our religion, that religion itself wasn't the problem. That still the problem lied within the person, and there was a complex interaction between the internal psyche or psychological matrix of the person and their relationship to their tradition and how they practice it and how they held their beliefs. So I thought this was very important to make this distinction that James said the source of, that religion could amplify our negative self-judgments to an extreme. On the other hand, it can modify or mollify and help us experience, profound love of God and the deep absolute value of our hearts and these type of things. So this is just to outline that the big picture of religion and psychology in the West, at least, has been tense. But like I said, there has been psychological traditions that are generally more friendly to religion: Jungian psychology, humanistic psychologies, especially Erich Fromm's work. These are just a few. I'm sure many of you out there can name some more. Logotherapy, Frankl's emphasis on meaning, transpersonal psychology, and that tradition really recognizes spiritual dimensions. Buddhist psychology and mindfulness training, which is becoming, very, very popular and well known, especially through the National Institutes of Health research on meditation and how effective it is to help reduce anxiety and stress. There's been the rise of somatic or body-centered therapies, which are also can be more amenable to religion or religious traditions. There's the whole Eastern therapies that have come, Qi, prayer, Reiki, emotion code, many things that are recognizing there's more subtle dimensions between, the physical body and the mental content of our mind. And there's many therapists these days that actually, if you read their websites, they have gotten themselves trained in many different kinds of things, from cognitive behavioral and EMDR to coaching and psychoeducational approaches, because as the field has developed, especially the last 30 years, it's just becoming, religion is becoming more diverse, and knowledge about and openness to spiritual practices has become more accepted. The rise of yoga, for example, again, or meditation, or these things are becoming commonplace, so people aren't afraid of them as much anymore. So what about within our movement? Why has it been so difficult to talk about these things and to sort of wrap our minds around them or even address them from the pulpit? And at least in America, we have both historical and cultural tensions. Again, I don't need to belabor this. I'm sure many of you out there could fill in with many stories of your own experience, but we were labeled as a cult. This kind of, especially in the 1970s, we, as a new religious movement, we had this us versus them. We were very aggressive with our evangelism. There was a general, especially in the Nixon era, because of the Korean War and this kind of fear of Asian invasion and fear of these new gurus coming and new religions in general, which were suspect. So we were kind of all lumped into one box. And all the court cases and the people who tried to label our religion as psychologically destructive in itself. And then inside of our how our blessed families, we were asked to do sacrificial and extreme lifestyle, and we didn't want to look bad to outsiders because we were always trying to prove how good we were. So that created this roadblock for us to even, for many to get help that people could have benefited from. So really, there's many, if you think about it, there's many practical reasons why this topic is still kind of hush-hush in our community. And when you have participation in kind of a closed group that has so many dissonant values or lifestyle, what looks like dissonant lifestyle values to the larger culture, that itself sets up tension and anxiety. So just being in the group and experiencing God's love through brothers and sisters and our teachings and our work and building good families, there's nourishment there. But in itself, being part of a closed group, always having to negotiate with the outside world and negotiate my sense of identity inside and outside. Now of course, those kind of boundaries are sort of melting down or breaking down, which has its positives because there can be much more integration. And also, I run into this view all the time. We are blinded by our own light. So again, these are just some points, and again, I don't want to spend too much time on this, but I think it's important to name some of these roadblocks that have come up in you could say, the body or the network of unification families. So it's this idea that new revelation and new spiritual practice that is highly redemptive, like the blessing itself, should somehow fix every human family problem if we just live the tradition correctly. Now, that may be true, but it's difficult to live something so purely incorrectly when you've got all this personal stuff that hasn't been taken care of. So there is this kind of a tension in all traditions, where you're devoting to a tradition or you're devoting to a practice, whether it's Hunduke or preparing the holidays like the Jewish families around my neighborhood do, and my own personal restoration or issues that I have to work on. So those things are always going to be in tension. But we also have held within us this sense of shame. What will the neighbors think? I mean, I can't tell you how many times I've advised people who call me. I said, well, have you gotten assessed? Go find a clinical psychologist or a psychiatrist, and if you really, I can't tell you if you have bipolar disorder, but go get an assessment. And one of the first things out of people's mouth is, well, I have to explain the church and they won't understand it. And, I talk people through that. Well, maybe you will, maybe you won't have to go, maybe it's relevant, maybe it's not relevant. But it's this, what's behind it is this sense of shame. And maybe this is more in like the first generation than the younger people. But I know it's a huge issue. And it was for me too. I struggled with this issue when I went to see a therapist. So also, unless you've gone out there and tried to solve problems, we may have our leaders or those in positions of influence may be very ignorant, just not aware of the new therapies out there and the different modalities, and the fact that therapists are often much more highly attuned to be sensitive to cultural and spiritual traditions. And there's also tons of research on a lot of different therapy. Not all therapy is well researched, but some is. So we may just not know what we don't know, and that's something important to just put on the table. Also, because we have a strong understanding, and we all have our own individual experiences of the spiritual influence in our life, the positive spirit world, and Champyong, and this emphasis on making conditions to sort of move the spirit world. And I think that's important, but it can be overemphasized as like spiritual methods are the real solution, and anything else is just, well, not so good. So I think that should at least be questioned. At least it should be questioned. Also, again, we have, it's not just East-West. It's generational, some of these issues, and it's Western tradition, Western psychology, and Eastern traditions of spirituality are just coming into dialogue, into vogue right now, and so there has been tension just in general, like feeling of suspicion, and also sense of competition. Well, if we send a member or we suggest members, go to see a psychologist, there's this fear that they're going to be talked out of their religion or faith. And, in some cases that may be true, but maybe in the past that would be more true than I think is true today. So they won't understand the church. That response that I get, like I got it today, I often respond to the person like, well, let's think this through together. Because there are there's more diversity out there in the general public that, the therapist might be a practicing pagan. I mean, you never know. They may be very open to new religions, and they may have been trained in cultural competency and how you don't judge religion, or how you let the person talk about it themselves, or people can choose to talk about it or not talk about it. But overall, there's been a lot of research actually on religion and mental health the last 30 years, and a growing body of research. So the Handbook of Religion and Mental Health reviewed hundreds of studies on, well, what is the relationship between religious participation, and there's many ways researchers define religion, or religious participation, religious belief, religious practice, but overall the research suggests that it's very positive. So overall, participation in a religion has positive outcomes. Now again, yes, every therapist or every doctor has their own personal biases, but there's a lot more knowledge in therapeutic circles, at least these days, that it's not necessarily bad because you're a devoted religious person or you have been a devoted religious person. It may be one of the interesting artifacts or living conditions of your life that a good comprehensive diagnostic assessment would look at. meditation was seen as something weird and, you know, cultic too in the 1970s, and now we have federally funded research on it, and so much so that it's included in some employee health and health programs and insurance plans. So that is a huge shift from 10 to 20 years ago, and yet what I find is that the attitudes that our church grew up in America towards psychology 10 or 20 years ago are still, you know, circling around and preventing people from seeking treatment. Also, there's just so many interesting targeted therapies. There's brief therapies, there's depth therapies, and there's things that, you know, will work for one person and will be effective for one person and not effective for another. But there's such a range of treatment modalities that it seems such a pity to not pursue something because, you know, there's this big sense of shame or ignorance out there. And there's spiritually informed therapies. There's often Christian counseling services. Sometimes these are in churches. Sometimes they are, you know, pay-as-you-go, or licensed clinical psychologists that say, you know, we also have sort of biblically informed therapeutic methods. It's interesting because when you look at, you know, who goes to therapy, I mean, there's again social science research out there, who goes to therapy? Well, it's the white people. That's true. In large, you know, the therapy consumers are, at least the traditional psychodynamic psychotherapy consumers are largely more middle-class people. And when you query very devoted, let's say, Baptists or black folk, they also don't feel very suspicious about going to a psychologist or a therapist, but that's also because there's so few people, black psychiatrists, like less than 5% or less than 2%. So we're not the only group of people who has suspicions, or really underneath it all are looking for some kind of cultural resonance in when you seek help, whether it's a doctor or, especially for a mental health practitioner, you know, you're really talking about a person who may deal or help you deal with your inner world. And so that type of helper makes us want to feel like they know, or they may have some, you know, sympathy, or that will be understood properly. So hospitals are themselves becoming more aware of how important it is to provide people with services that are culturally informed, and that includes religious, you know, religious understanding. Okay, so the point I want to make in this slide is your symptoms are the first issue for any therapist. Your religion may or may not be relevant to a comprehensive diagnosis and treatment plan that you construct with various healthcare providers. And I think that we should think very deeply. There's many parts. I mean, our worldview is so vast and deep, and yes, while some people say, well, you know, I know many people who've been helped by Champyong and going to Champyong and doing ancestral liberation, and some people haven't. And I remember when I was over this like 12 years ago, when Dr. Jin was the head of the hospital there, and Dr. Kyung-hee Chin and I worked together at the University of Bridgeport for years, and I went over there, and I knew this was before they were I think they had just opened the mental health psychiatric facility, and I remember hearing that it was Damon Nim's ideal or dream or sort of plan that she would take the most difficult crazy people, or, you know, mental cases of mental illness that other psychiatrists couldn't solve, and she would solve them here because we have the, you know, we can mobilize the spirit world and these things, and therefore testify to Father, and, you know, rich people would give us so much money. And I thought, oh, well, that's an interesting approach. I hope it works. And then, I always thought, well, if you've got great stories or people are really being healed, on a deep psychological level, like if somebody comes over there with, schizophrenic behaviors, are they really healed when they go back? I don't know how much data they collect or if there's real, things to talk about. But certainly, if and when that level of healing happens and we can document it, I'm sure we'll have something to crow about. But for right now, my sense is that try many things and don't leave any, when you are struggling with a problem, you should seek many different kinds of perspectives on it. I also think, some of our concepts that, human beings are microcosms and that reality is holistic. So in other words, that if you change your nutrition, for example, sometimes your depression goes down. If you get more sunlight, sometimes your depression goes down. I mean, depending on what the issue is you're trying to solve, that there are many ways to break into a system of pathology or imbalance, and that our emphasis on personal responsibility and also our understanding that through problems coming from our lineage manifest within the individual mind-body conflicts and seeks internal psychic conflicts and between in relationship dynamics. So I think there's plenty of conceptual support for seeking different kinds of mental health treatment. And therefore, I think in general, Father emphasized the importance of science, and I would, under that rubric, put social science there. So I think that overall our perspective is that interdisciplinary approaches are highly valued. So I think there's plenty of theological support for pursuing and just being comfortable with saying, this is a mental health issue. We don't always have to frame it as a spiritual issue. We can use different terminology. It's okay. So, I mean, I just threw this in there because I thought, well, okay, what is health? Mental health, physical health, emotional health. It's a state of balance, and this requires kind of harmonious interaction among our multiple dimensions of who we are, from our deep inner psychic life to our physical life to our relational life to our public life. That is like this ultimate state of balance. And you can say we live in a negative environment. We're bound to have, the context, the stressors from context. We also have imbalances that we're born with. We also have imbalances that we used, as coping mechanisms throughout our life, like alcohol, or, if we overeat or something like this, it was a coping mechanism. So we may have damaged ourselves on being unaware of these things. So in long-term, trauma from childhood, all these things create imbalance. And I always think, going to a therapist or a psychic healer or an energy practitioner, Reiki or Chi or emotion code, you're seeking to make some kind of systems change, right? So sometimes a little bit of effort goes a long way. So that's why I would say I'm a big proponent of integrated, a comprehensive approach to rebalancing ourselves as much as we can, given our short time on Earth and the fact that we don't have all the time in the world and don't have all the money in the world to go to lots of yoga retreats and seek out, the best, most comprehensive plan. But I think one size does not fit all. Again, these are general principles that we should value science and research-based health practices perhaps as much as we value spiritual approaches. I also think, and even the National Alliance, NAMI, for Mental Illness, they're a great resource group, and even the people who are struggling with very who have to live, let's say they can't function so well in a family situation, they're in a group home and they're struggling with, bipolar disorder or, schizophrenia, still the emphasis is on you've got to take as much responsibility as you possibly can. No longer does society, unless you're really, really cognitively or physically or developmentally impaired, no longer will, people just get stuck like, one flew over the cuckoo's nest in a mental hospital. For better and for worse, that's why we have so many homeless people running. I mean, what's one of the contributing factors, and our veterans, don't have enough services, but that's another story. My point is that there are many things you can do in the short term and the long term to alleviate symptoms and to make yourself feel better. And it's important to be responsible, even if you're if you're struggling to get off the couch because you're so depressed. What can you do? And our religion teaches personal responsibility, and I think that's very important. That's emphasized more and more in many treatment plans. So I think, again, emphasizing that again, that when people call me and they're coming, often describing a spiritual problem with their kid, and it sounds like, okay, the child is depressed, or, I mean, it sounds like, to my mind, they're describing, severe depression, and I'm, quickly ask them questions about, if there's any suicide, what I would say is, behaviors that might be signs of that. And then I sort of try to get people's understanding of what the problem is, if they see it just as a spiritual problem, or if they have pursued any other treatment. Have they talked to their doctor? Have they looked up any other therapies, nutrition or acupuncture or anything? But I think it's very important to get a comprehensive sort of understanding about whatever it is the situation is. Whether it's, gee, I've started drinking again, and I'm having, I noticed my drinking is going up, and gee, do I have alcoholism in my family, and did I ever take care of my own conditions for that? And I mean, there's just many, many ways, our life cycle can hit us in different ways. Where we were vibrant and really together in one time of our life, we can hit menopause, or have a baby, or hit chronic illness like diabetes, which makes us feel sad or struggle with deep unresolved feelings that make us only semi-functional and not so happy. So getting a comprehensive understanding from various sources, and there's such great knowledge out there, and part of it is sifting through it all, especially if it's your child or your spouse having severe symptoms and you don't know what they are. So many people will try to treat the you could say the most transcendental causes, lineage problems, without treating behavioral symptoms first. So I don't think it's an either or. I think sometimes you could probably do both, right? You could take your medicine and you can do spiritual conditions, or try one before the other. But I'm a big advocate of monitor the results. If it works, great. But for my sense is for long-term chronic issues, you really need a holistic plan. And you should get your information from many sources, not just, let's say, from a spiritual source. Identify trustworthy mentors and guides. Are there people out there who've struggled with this issue? And can you hook up with them and listen to what worked for them? And maybe it won't work for you, but maybe it will. So again, I sort of tell people, well, ideally you want to do something, spiritual, nutritional, usually exercise, or something to do with your body. You can get your body moving if possible. You might need medication, and take a long-term and short-term approach. And then I get very specific with people. It's also important to remember, I'll get back to the specifics in a minute, but I think it's also important to remember, if you are a person whose spouse or child has real difficulty bipolar disorder, for example, can be extremely scary in a marriage, and I have coached and supported a couple close people to me through that. And it's you know, you can go through some very scary periods, and you as a not necessarily yeah, I mean, you're supporting that person and you're giving care. You also need support. It is a shock sometimes when there's a chronic illness, whether it's cancer or a mental health condition. In a marriage, it becomes almost like it redefines the marriage, right? It becomes this big thing that we have to deal with, and almost redefines us. So especially for couples, as we age and we go through these life stages and have to deal with so many physical and emotional, you know, difficulties, you have to try. Each person has to realize that they have responsible for their own, as much as they can, their own health, mental and physical and spiritual, because you have to be stronger within yourself to really be a support for the other person, so that the other person can is more likely to take more responsibility to help themselves. Because denial and I don't think it's laziness. I think it's more, sometimes it's laziness, or sometimes it's just not fully understanding what they could be doing to help themselves get out of depression or to make the situation better. So I've given lots of advice that some people take seriously, and I've given lots of advice that nobody follows up on. Like, did you Google a 12-step program? Maybe there's a 12-step program to help you if you can't afford pay out-of-pocket therapy. So there's lots of things people can do, and they one person wrote to me and said, well, my spouse is afraid to go to therapy, and because he doesn't want to explain about the church, and they want to talk to a church member who's a clinical psychologist. Do you know of any? And I emailed back and I said, well, I know some people with very good clinical practices, and I could recommend them, but A, they're not necessarily free, and B, I don't think a responsible person would do a diagnosis over the phone. They might say, well, it sounds like this, but generally all help is local, or a lot of help is local. Not all of it. You can do some phone counseling is great, and it's good for support, but for more severe issues, I think you've got to look closer to home and look in your local community what the resources are there. And the spouse has to, or the spouse or the parent, of course, managing your own fear and anger and disappointment and sense of responsibility is difficult. So that's when you really need to call on your friends and try to do some research to help the person. Get your own support system and do your own homework about the situation, and know what your boundaries are. Know what you can do to help someone and what you can't do. If a person can manage their illness by taking medication and they refuse to do it, well, that's very difficult. And it's very difficult to watch people suffer, especially mental anguish. And sometimes it's very difficult to know when to, drag them to the hospital or, whatever. So there's a great deal of support needed, and we have to know our boundaries. I mean, again, a very common issue, well, not common, but, well, I mean, if people are calling me, they're usually because they're have a problem to be solved, is a domestic violence issue. And I often ask people, do you know the domestic violence hotline in your area? Have you looked at community resources? And that is often met with, no, I would never ever think of that first. And it could be because they just are scared, or they feel so ashamed or guilty, but that they don't know that there are really competent people close by that could help them. So I certainly don't try to solve the world's problems, and nobody can really solve anybody else's problem. You have to encourage people, and then, you know, really help yourself. You know, the helpers have to help themselves. And, you know, there's lots of things to just accept and go to God about, and that's embracing change, and that's where our you know, personal prayer life can become very, very critical, and you know, even our dream life, our prayer life, our deep intuition about which way to go and which doctor to trust, or how you know, I mean, there's certainly a place for deeply spiritual or intuitive approaches, especially when you're trying to turn over every stone on how to, you know, help a child or a spouse get better. Okay, so these are my typical, what I call my triage questions if someone calls me. And I ask about the symptoms or the behaviors or the relational patterns or dynamics that are of concern. So I try to get people to like describe things, and then I ask, because I know that a lot of the resources in our society are paid through third parties. So I ask, do you have health insurance? What does your policy cover? Do you know what mental health services are covered under your policy? And lots of people don't, because they never ever thought they'd have to, you know, get a diagnosis for learning disability for their children, or panic symptoms or something like this. So people may not even know what their policy covers, and it's important to know. And now with you can get health insurance under the Affordable Care Act. Especially if you're very low income, then you have a very low premium to pay or nothing, and that does cover some behavioral health services. Also, I ask, particularly relevant in our church community, is what is the language or culture of the person with mental health problems? Because this can be a huge barrier. And finding, I'll give you an example. There was a family that I worked with last year, and the mom was Korean and the dad was Western, and the teacher, they had a very active, rambunctious son, young son, second grade or third grade, and he didn't bring his homework in or something like that, and then he mentioned to the teacher that his mom had punished him, and I think she made him kneel on rice. Okay, and the teacher called Child Protective Services, and you know, and this is a model family. I mean, they're just model. They're just like such a loving family, economically stable. Like the kids they know 3 languages. It's a great family, right? But the teacher, did what teachers are supposed to do, right? They're mandatory reporters. Oh my God, that sounds like child abuse. And this mom was so upset. I mean, she had insomnia, and she was, had severe anxiety symptoms, and I knew I couldn't just say, oh, go see any old therapist. So I just started calling until I found, and they're not easy to find, a Korean clinical psychologist. And I talked with her, and, just because she could talk in her own language to someone who wasn't a church member. This woman happened to be Christian, actually, but that person could really help her and give her an understanding of the system, and I'm sure it'll be cleared up, which it was. The situation was cleared up, but how important language and cultural resonance is, that we feel comfortable with the people that we're seeking advice from. I also ask people about what is like the role, like I try to assess how people's beliefs, how their beliefs impact their understanding of the problem. Because that tells me a lot of maybe what they have tried. And some of the things, that people try are really, really impressive to me. And I learn lots of new things from people who I try to help, at least. But I think that particularly in our community, the role of our beliefs in relationship to the problem is something that needs to be thought about, at least. I ask always especially if it's a depressed teenage kid, have you talked to your primary care physician? Some of us have great primary care physicians and we can talk about these things, and some of us don't. But it is one of the first sort of lines of defenses, and it costs you a copay to talk about it. And what approaches have you tried? What have you done? What treatment have you sought? And what are the results? And if people say, well, I don't know what's out there in my community, I say, well, do you have 211, which is I don't think every state has 211, but 211 is something you can call, and they're trained people, and if you say, here's the problem. I remember I worked with a family, and the issue that they were struggling with was severe sibling rivalry. Like, one child was being very cruel, I mean extremely cruel to other younger children, and I said, okay. They said, well, what do we do? Do we go to a therapist, a parenting group? And I said, I'm not exactly sure. I said, I'm sure that there are specialists trained, in this. So call 211 and ask, describe the situation, and they'll at least give you some leads. And 211 is staffed by people who really know what's out there in the community. Now, they may not know all the services, let's say, mental health services that are associated with specific religious communities. Like some of the bigger Christian churches often have services that other religious people, you don't have to be a member of their church to access. But that's a great resource I often point people to. And then, what if the issue is money? Oh, I can't afford it or whatever. Then I say, well, have you looked for free or low-cost resources? 12-step programs are great. What are the domestic violence resources in your community? Are there men's groups? Sometimes hospitals will have very good outpatient clinics for a very modest fee, or if there's a training program at a university, where people are training to become therapists. They're supervised by PhD clinical supervising, and their services can be very low cost. So there are state and city agency programs. You just kind of have to dig around and see what's out there. Also, I really like the National Alliance for Mental Illness, NAMI, N-A-M-I. They have a lot of great parenting support groups and parents who've dealt with lots of difficulties within their own marriages, or children with a range of mental health issues. So, okay, so I just thought I'd bring this issue up, to medicate or not. The explosion, you could say, of the rush to medicate has also created life-saving drugs, but also it can be problematic. So I'm not personally against medication. I've taken anti-anxiety medication myself to treat my insomnia after my mother's death, and it's truly, truly helped me function. And, I faded off of it, but it can be medication, that it treats a psychological problem or a psychological imbalance, can be extremely helpful. Oftentimes, there's a lot of literature on how overprescribed it is. And it can be, people can get dependence on medication, and it can have all kinds of side effects. There's, maybe the first defense, if somebody wants to do something, I always say, well, look at your nutrition. Go to a good homeopath or naturopath, or just, be honest about your diet. What can you change? What's not serving you? How can you help balance yourself that way? I'm a big believer in energy work, whether it's through meditation, through qi, or some kind of something that deals, of course, physical exercise and yoga, and that's good, but I think there's a lot of potential in energy work. Is a big label because it covers so many different kinds of healing practices, but it's that place of the more subtle body, or spiritual body, or the moving one's energy through martial arts, meditation, chanting, deep prayer. I think hands-on healing, distance healing, Reiki. I think that that's a very important component if you can do that, if you can access that, or and we have some very good practitioners in the church, actually. Spiritual healing, herbal remedies, traditional psychotherapy. If these are done with medication, then generally medications can be very positive and helpful. But getting the right medicine and getting the right amount of medicine to take sometimes takes quite a bit of time, and you have to persevere and assess. So if you're taking medicine, or you're trying to help your children take medicine to solve a problem, or to at least reduce symptoms so you can then solve the deeper causes of the problem, I don't think we're necessarily against it, but it's always good to be your own best advocate and stay in touch with your doctors. Get more than one opinion and be informed as possible. Okay, so I just want to move on quickly to check my time here. Oh, gosh. Okay, so what can the Unification Church community leaders do? First of all, we can talk about this issue. Include mental health topics in Sunday service. Do your research. Look at the sermons of Rick Warren, and I think his new ministry is incredible, but there's lots of great sermons out there that you can learn from, or research a topic, or find some stories of people who overcome things. I think it's really important to talk about it. We could co-sponsor information events with other faith communities, because this is a common ground, and it's a common struggling issue in many other religious communities, whether it's very devoted communities or very liberal communities. This is an issue. We're not the only community struggling with it. And I think, mainly we have to deconstruct shame. And we have to emphasize compassion over pride or ignorance or fear, and realize that, we're just people doing our best, and we have profound gifts from our true parents, and yet we have to make a lot more effort on embodying those gifts. And we can do that as colleagues with other faith people, and we don't have to hide behind shame anymore. Also, I think it'd be great if every Unification Church community had a community resources list. Ask around who had a problem, what helped them, where's the AA group that's really good, where are there low-cost or free other mental health services around? Because a lot of, when people say, well, I want to talk to a church member about this, we don't have a huge resource bank of clinical psychologists and psychiatrists. We have a few, and we have some good people, but they're also working adults, and a lot of, and so it's maybe great to use professionals in our community as resources, but a lot of the solution is in the daily grind, right? Is local, or within your reach. So you've got to find out, and I think it'd be a great thing for community leaders to do is put a resource list together, or just start one. That will also just simply reduce the shame, and also promote people to sign up for health insurance. Whether, I don't care what you feel about Obamacare, if you're low income, it's probably going to benefit you. And to get to some behavioral health services and preventive services. So also share what works with your friends. And okay, I thought this is a photo. I want to end here. This is a photo of a sunrise on a cold winter morning, because sometimes mental health issues feel very cold, and you can feel very lonely when you're dealing with them. And know that there's a sunrise waiting for you. Thank you for listening.